You talked about the fact that when it comes to different, nanoparticles, they can get lodged in the body. Is that the same thing when it comes to hydroxyapatite? What is the fear people have over that?
Right. It's a great question, and there is a lot of it. I'm very surprised. I'm the first one to cave in. I'm so paranoid about everything we put in our mouths, in our bodies. Uh, it's almost an affliction. Discussing and filtering everything that goes in your body. But the nano, first of all, it's been considered this specific version, this rod-shaped nano version. And it's in a globular, a fluid. It's made by a company called Fluidinova. It's called Nanoxim. That's their brand name for it. And it is currently the only version of nano-hydroxyapatite. It's got hydrogen groups and water. It's a little globular liquid version of nano-hydroxyapatite. And it dissolves very quickly. It stays in suspension, and it's readily available when the tooth needs it. And if it does get out somewhere, calcium dissolves. I mean, without calcium, we would be dead. So there are some studies. There's a zebrafish study. A zebrafish is not the same as a human being. We have totally different protective mechanisms and even cell walls and all of that. So you can overcome a zebrafish very easily with so many different things. Even a hypertonic solution will kill, or a hypertonic solution of salt will kill a zebrafish. So there are a few studies out there. They're old. This is a product that was designed by NASA 40, 50 years ago. It's been in use by the Japanese and less recently by the Europeans for 50 years. Something would have come up. There's some oral surgeons out there that say this is causing calcification of the pineal gland. Calcification of the pineal gland occurs with calcium, period. Any calcium, a calcium supplement. It can occur with fluoride. And it's really about your calcium metabolism. You should really worry about what any calcium that you take in can be from leafy green vegetables. It can be from a supplement. By the way, I don't recommend calcium supplementation, but I do recommend that you worry about your K2 levels, the amount of this vitamin that literally is the shepherd. That's a great word. I forget who used that term. I loved it when I heard it. It takes the calcium to the right areas. It takes it out of the bloodstream and puts it into calcified tissues. And that's where you want your calcium. And it also takes calcium out of tissues that shouldn't be calcified. Or if it needs calcium, it'll pull it out. It'll also pull it out of bone marrow and the reservoirs of calcium. Calcium metabolism is second in importance to glucose metabolism. If we don't get it right, we're dead in the water. So I'm not worried about calcium at any size as long as it's dissolved, because calcium, every cell has calcium in it. It needs it on both sides of the cell wall. So again, it's approved. It's been tested. There's a group in the EU called the SCCS. It's a Scientific Advisory Council. These are very well-known scientists. They have a 3-year stint, and then they're replaced. I don't think they're paid to do this, and their votes are silent so that they're not, punished by the industry in case they know how they voted. And they approved this version, and they were very clear that they're going to approve other versions. And they're also that same committee that are trying to redefine what is a nanoparticle. But if it's nanosilver, nanotitanium dioxide that's in sunscreen, once that gets out in the body, it's toxic. The body has to wall it off. I agree with that. There are nanoparticles that should not be used and we should not be exposed to. Microplastics are small enough to cause a lot of harm. Are they breaking down into nano-sized particles? I don't know. So it's safe. It works well. Back to what you said at the beginning of this topic, you were wondering, you were commenting on the fact that I said micro is pretty useless. It is. It just doesn't work as well as nano if you compare the two. So I would want nano in my toothpaste because it works so well. I know it's safe. And you just have to use the right version of it, and then you'll see the results. If you have sensitive teeth, nano-based toothpaste hydroxyapatite toothpaste will work within 2 to 3 days. It'll be the best solution. These people have been looking for a solution for a long time. Sensodyne, pyrophosphates, resin covers, coverings, fillings at the dentist. Most of that stuff doesn't work. In 3 days, a nano-hydroxyapatite toothpaste will work because that's how quickly it remineralizes. A micro won't do it, ever. Now, there are some toothpaste, and I think this is very smart. They have micro and nano in their formulation. It's good to have micro in saliva because it helps with the ionic stability and integrity of saliva. Saliva needs this ionic structure of minerals. There are other things in saliva that are also important, and the microparticles help maintain that. But when it comes to remineralizing teeth, they're left behind. It's the nano that does all the heavy lifting. So I'm okay with nano. I've done so much research. I am probably the most paranoid person out there when it comes to healthcare. Probably not, but I'm up there. And I've researched this. My grandkids use it. It works. And I would rather have them use this and not get cavities, which then later lead to bigger fillings and then crowns and then root canals. So anyway, it's safe. It works. Just make sure you use the right version and make sure it's in a toothpaste formula that doesn't have other issues like surfactants and emulsifiers and things like that. And then, of course, you have to thin and modulate and break down and reset the biome so that it can absorb these minerals.
If you enjoyed that clip, press here for the full episode. I'll see you over there.
Most acidic drinks like kombucha and a lot of mineral waters, Perrier, for example, they're pretty low. Coffee, wine, iced tea, my favorite, those start off at a low pH. And if you're drinking a lot of that,